So you've battled gum disease and you lost a tooth or two. Now you're thinking, I need to have some teeth replacement. I need implants. Can you get an implant? Well, listen to this exciting episode of the Wonder Tooth podcast. Before I keep going, make sure you put code 78 to get a free consultation from our office in Princeton, New Jersey. And make sure you like, subscribe, and write me down below in the comments if you have any questions. My name is Dr. Saad, and I am your host today. We're going to talk about if you are a candidate for dental implants, even though you have or you had gum disease. Before I continue, let me introduce myself. As I said, my name is Dr. Saad. I am a dentist of more like 20 years of dental experience. I'm licensed in the United States and in Canada, and I've done it all. I'm a general dentist, but I have a lot of specialty. I have a master's degree in implant placement and restoration. I am one of the top digital dentists on the East Coast in the United States, and I am the past president of Mercer Dental Society, which is part of the New Jersey Dental Association, the American Dental Association. I am on the executive board of Mercer Dental Society, and I'm also a speaker for Dentsply Sirona, which is one of the leading companies in the world, dental companies. So let's talk about, dental implants and gum disease. What's going on? How can you tell if you have gum disease and you don't? Like, basically, what is gum disease to begin with? So gum disease, it's called periodontitis, which basically it's a gum infection. And some people are more, unfortunately, are more at a risk to have gum disease more than others. A lot of it comes from genetics, or if you have an inflammatory disease like diabetes, or basically poor oral hygiene, among a lot of other things too. If you're not flossing, of course, you don't go to your dental checkups. There is a whole lot going on. But let's say, okay, you are confirmed you have gum disease, and now what can we do about that? So gum disease, basically, it leads to the structure, the substructure of your teeth, the foundation of your teeth. Now there is a damage. So you have a tooth, and all of a sudden you start to floss and you have bleeding, and then little by little you're getting food stuck and you don't know, and then the bleeding is more. And some people actually, when they wake up, they find bleeding like on the pillow. And this is like, okay, this is when you really have to go see a dentist like right away, but you shouldn't really wait that long. But basically it's severe inflammation. It's an infection in the gums, and that can lead to tooth loss. So what can be done about that? And I'm pretty sure some of you might have it, and you might have lost already like a couple of teeth because of gum disease, or some teeth are very loose and you're still hanging on to those teeth. Guys, do not hang to those teeth, because their damage of keeping them in is actually way more than getting rid of them. And I'll tell you why in a minute. So basically, when you start to get, the mouth has tons of bacteria. There's like millions of bacteria that live in the mouth. They live in harmony. They're happy, okay. And, as long as your immune system is pretty much controlled, you're not taking antibiotics, you're not taking certain medications, because certain medications can cause dry mouth. So that can also lead to xerostomia, which is a dry mouth, and a lot of complications that can happen after that. But let's say, you're healthy, you just, didn't take care of your gums for whatever reason. There is no dentist around you. There is nobody that you don't like around you. Anyway, so now we have a problem that the teeth are getting loose and we need to get rid of them. Okay. So when you go to see a dentist, they have to take an x-ray and they have to do the measurement. It's very important, guys. Make sure when you go to see your dentist for the first time that they do the measurement. What is the measurement? So basically, they check your teeth. Okay, they took x-rays. They do the clinical exam, which is basically they get that little tiny probe and they start to see if there are cavities or not. They look at the x-rays. But then the most important part for a new patient is to bring that little probe and then basically go check around each tooth and take measurements. And what is that? This is called periodontal charting. This is very important, because this actually tells you, or tells them, if there is a pocket or not. The x-rays, these are two-dimensional x-rays, the small x-rays that we take, so it doesn't really show much, because sometimes there are things that are overlapped. So you want to go clinically and check. And when they do that, so the norm really is between 1 to 3 millimeters. And what is that? What are these numbers? So you know your tooth. And guys, if you are listening to me and I'm actually talking, and there is a video about that, so you can watch it on YouTube, the Wonder Tooth podcast on YouTube as well. So basically the measurements are, this is the tooth and this is the bone level, and then there is the gum on top of it. So you put that little probe and it should read the measurement from the top of the gum to the top of the bone. And the measurement in normal, like people, you know, who have no infection, it should read from 1 to 3 millimeters. If it starts to get deeper, this is when we get a pocket, which is basically like a separation in the periodontal ligament. And the periodontal ligament, it's a very tiny ligament that's holding the root of the tooth to the bone. And if you start to get a little separation there, sometimes it could be because the gum is just very inflamed, you know, pregnant ladies, hormonal changes. It can, we call it a pseudo pocket, but if it's getting deeper and like 5-6 millimeters, this is full-blown gum infection. And sometimes if you don't take care of it on like, you know, like quickly or quick enough, basically it starts to get deeper and deeper until it reaches basically the root, the bottom part of the root, or like beyond the root. And this is when it's beyond repair. Sometimes if there is a lot of bone loss around it, the tooth starts to become loose because the bone now that's holding it is like, I'm done. What you guys doing? Just get rid of me at this point. Some patients, they don't want to get rid of those teeth, even though there is so much mobility. And I say, now you are not just like you are losing this tooth, but you are now at a risk of damaging the 2 teeth on the side. And why is that? Because now there is a big infection and basically the bone is gone around that particular tooth. And what's happening now, the 2 teeth on the side, the poor 2 teeth on the side, they're losing support too. So you are literally damaging now 3 teeth, not just 1. And this is where I always say, once you start getting some gum infection, or you start to like a little bit of bleeding, or you're getting food stuck, or you know something is off, you have to go to your dentist and get that checked right away. We are in New Jersey. If you guys, you know, I'm more than happy to see any of you, or even if you want to write it in the comments, you know, how to get a consultation, or even send me the x-rays and I'll take a look and let you know. But basically, well, x-rays alone is not enough. Remember what I just said, we still have to do the clinical exam. But basically, when you keep that tooth in place, which there has a big infection, not only it damaged the 2 teeth on the side, but you are even at a higher risk of getting an infection, septicemia now we're talking about, like general, which is very dangerous. Because, you know, the bacteria is not just sitting there doing nothing. It's literally kind of eating the bone around it, and it can get into your bloodstream, and then boom, this is emergency, this God forbid, like a brain abscess, or like even worse. And why is that? Because there is so much lymphatics here, there is so much, like, you know, it's head and neck. We don't really like any infection in the body in general, but mostly in the head and neck. We're too close to the brain, guys. So you please, you have to get, you know, any loose teeth, they need to go. If they're completely like beyond repair, they need to go, because you don't want to risk your own life. You don't want to risk the 2 teeth on the side. And basically, you just don't want an infection in your body. Okay, I hope this is clear now. Okay, so let's go back and say, okay, now I have gum disease. The teeth needs to go. What are my options? Well, of course, a denture is an option, you know, like a removable denture or a partial denture. It is an option. It's the cheapest option. In my opinion, it's better than nothing, but of course you need to have something more fixed. And why is that? Because removable, you know, putting it in and out, it still damages the teeth, you know, that are holding it, if there are teeth. Now, if there are no teeth and basically we lost all of the teeth, that's a complete denture. I'm gonna get to this in a minute. Okay, let's say, you know, I lost a couple of teeth here, or those 2 teeth are loose. What do I do? Can I get implant, or can I get a bridge? Or can I get implants? Because this episode is about really about dental implants. So I can say, yes, you can. But it's going to be a big protocol to get to that point. Yeah, there is hope, absolutely. And we can definitely get some fixed dental implants if you had gum disease. But at this point, we have to make sure that it's going to be stable. So unfortunately, gum disease, they don't cure, like they don't completely disappear, but we need to have them maintained. And how is that possible? So first, If you have any medical, like a medical problem, like diabetes or any medical medications, as I said, can cause dry mouth, that can lead to more of a gum problem or basically bacterial problem in your body. So first, you have to make sure that your medications, everything is pretty much under control, like control diabetes. You're taking your medication, you're watching what you're eating, you're drinking enough water. If you have dry mouth, there are certain things that we can prescribe you, your medical doctor, or they can change to different medications that have, you know, less side effects. So this is one. Two, of course, if you have periodontitis or gum disease, you have to get that treated. You're not gonna be like, okay, pull my tooth and put an implant. Implants, they don't get cavities, but they can get gum disease. And this is the mind-blowing thing that I want everybody to understand, because a lot of patients stick my teeth out and give me implants. Well, we need to understand why we got to this point now, and we need to fix it first before we can get implants. Because we don't want to get, oh, like, yeah, let me do this, let me pull your tooth and put an implant right away without checking anything and checking the surrounding structures or the foundation, and then you're good to go. Especially also if you grind your teeth. If you grind your teeth because of some sleep apnea going on and you get implants, they don't work well if you put a lot of pressure on them, because it's a different dynamic. They don't have like the ligament, remember? So first of all, we're gonna get the gum disease under control. It will never cure completely, but at least we need to get it under control. And how do we do that? We have to do deep cleaning. Yes, it is the deep cleaning, the scaling and periodontal curettage. And how do we do this? So basically, usually if you have like, you know, one side, we do one side at a time. So we have to numb you, and then the hygienist, usually they go with like a very thin instrument under the gum and basically scrape the whatever buildup underneath, and then also do the curettage and the soft tissue. So hopefully the periodontal ligament, you know, kind of, and the gum kind of goes back to the root, the surface of the root. Sometimes if it's kind of persistent, we have to go back sometimes with laser, soft tissue laser, to kind of kill the bacteria and basically ensure that the gum is going back a little bit more on the root. So this is the first phase. Then what? After that, we usually bring you back 6 weeks after that to kind of go back and double check the areas. You remember that periodontal, like the charting, the little thing that we use to do the measurements, we have to check it again. Not really for the length at this point, but we want to make sure there is no bleeding, because bleeding gums, that means that there is an infection somewhere going on there. And of course, you have to be at home flossing and brushing and all the fun stuff. So once we do this, we have to bring you after that every 3 months for what we call periodontal maintenance. Now, periodontal maintenance, it's different than a regular cleaning. And I want everybody to understand that part. Periodontal maintenance is something between deep cleaning and a regular cleaning. It's something in between, which basically we numb the gum with just like numbing gel, and we still go underneath the gum to kind of clear that area a little bit more. Very different than a regular cleaning. Sometimes the patient's like, but my insurance doesn't cover that. Well, the insurance, you know, is basically your discounted rate. But they cannot tell you, okay, if we clean the top, what about the underneath? You're gonna still get the risk of losing the tooth if you don't get something a little bit deeper to clean whatever is deep down in the pockets, okay? So please, guys, understand that part. After you get the deep cleaning, the gum disease, it's not gonna disappear. The second is going to be, we have to do the perio maintenance, maintaining that area, because we want the gum basically to become stable. We want the gum condition to become stable, but it will never be cured, unfortunately. Sometimes in like worst case scenarios, which we don't get to this point, but sometimes we have to do a corrective surgery. Like basically we go and we cut the gum on purpose so that you can have access more to clean in the area. But that's basically, we're exposing the roots, we're exposing between the teeth, just so that we can get rid of those pockets. Okay, so number one, deep cleaning. SRP, we call it scaling and root planning, and that's gonna be done by numbing. Then the second is going to be perio maintenance, or basically maintaining your gums every 3 months. Okay, of course, diabetes, you have to make sure, diabetes or any other medications, you have to make sure everything is controlled. You're taking your medication basically. And then what? Let's say now that tooth is done, it has to be removed, and then what? in order for us to put an implant, we have to graft the area. We have to put what we call a bone graft and a membrane on top of that. What is that? So basically, when we pull the tooth and there is already some bone lost, I cannot sometimes put the implant right away. I have to pack bone in that area where the roots were, and then we pack the bone in, and then we cover that with a membrane. It's a collagen membrane, and it goes on top, and basically we stitch over it, and then we let that heal for like at least a couple of months. During that time, please, you have to take some calcium and vitamin D because it kind of boosts the bone cells. Okay? If we had good bone to begin with, then yes, but this is usually in patients who don't have gum disease. But if you have gum disease, and it's now getting under control, I cannot put the implant on the same day. It's not really, I think it's more risky. And of course, before we get to that point, the CBCT. I had a whole big episode about why it's very important to take a cone beam, like a CAT scan, to check the bone to see what's going on. But basically, the two-dimensional X-ray is not enough. You need to see three-dimensional now. So once the tooth is out, the bone graft is in, we wait usually for 2 months at least, sometimes even more, depending on how good your bone and also depending on the location. So certain areas like the lower jaw here is much stronger than the top. And why is that? Because of the type of the bone. The bone here is more compact, up here is cancellous. It has basically more air. And why is that? You know why? Because basically for your balance, for your equilibrium, you have the bone here is thinner, and that's why you also have the sinuses so that you can have more equilibrium. Okay, now remember we did the deep cleaning, we're doing now the perio maintenance, and of course at home, your job is going to be to floss every day, floss with the string, not the little stick, an actual string, and you're gonna do it properly. And sometimes when you have gum disease, you might have to go with the double floss to because if there are spaces between the teeth, it's double floss, or get like a super floss, something a little thicker to go in between and really clean every night. And you can get a water flosser that's an extra. It doesn't, you still have to floss, of course, and brush. Mouthwash, just a little bit of warm salt water if there is a little bit of bleeding, and you're good to go. Don't use mouthwash like the over-the-counter one for a long time because it changes your microbiome. You can actually end up with more calculus buildup, with more bad breath, with a lot. It changes the bacteria in your mouth. So please be careful. But warm salt water is from your kitchen. Just use it, okay? Now, let's say the gums are under control, the foundation is clean, we are checking with that little periodontal perio probe, and there is no bleeding. So that's a good sign. This is a fantastic sign. That means now that your gum disease are under control. You're doing your every 3 months, checkup and cleaning. So we're good. Now we can put the implant. And how we can do the implant, how we can place the implant? First, we have to take the 3D X-ray. And as I said, it shows basically all the infrastructure. It shows everything. It's completely different than a small two-dimensional X-ray. This is the standard of care now to put implants. If you go to a dentist that they say, oh, it looks good, take a small tiny X-ray, it looks good, let me put the implant. Don't do it. Don't do it because there are a lot of major structures that you don't want them to get touched. I'm talking about the big inferior alveolar nerve. There's a big nerve that goes here, and basically if that gets touched, severe pain, and you might get numbness pretty much for your life in that area. So this is very important. And up here in this, there is the sinus here. So if you had a tooth extracted and the bone was never grafted, or the socket was, no bone was ever put in there, so the sinus just loves the area and basically start to grow deeper, like it grows down, and we call it pneumatization. And basically you cannot just put an implant like that. We have to do a sinus lift before we put an implant. That's why it's very important, if you have a tooth that you are planning in the future to have an implant, you need to talk to your dentist about that. Don't let them just pull the tooth and then you have to deal with it later on. Make sure you say, I am gonna get an implant in that area. Maybe not now, but in the future, because it's gonna save you time and money and an extra surgery, basically. And it just makes life a lot easier, and basically the efficiency becomes a lot better. So let's say we took a CBCT, the bone looks good. Okay, now what? Now we go and do a little surgery where we numb you. You don't have to go under. It's very simple. It's, in my opinion, it's much easier than pulling a tooth. And I tell patients this all the time, much easier than pulling a tooth. because basically we numb you a little bit, we make a little incision in the gum, and basically we start to drill little by little. We take a couple of x-rays during that, and basically we put the implant. And the CBCT is important because I already know where I'm putting the implant, the size of the implant, the wet, everything. I can see that, like, this is 50% of the diagnosis and the size of the implant. I already know it. Okay, so it's very important. If you don't listen to anything today, CBCT is very important in implant placement, and you can still get an implant even if you had or have gum disease, but it has to be controlled completely, and of course, good oral hygiene. So basically we put the implant in, and then we stitch and we let it sleep. I used to do a lot of guided implants too, but I will talk in another episode about the pros and cons of guided versus just the traditional, the old style. I did it all. I've done a lot of implants. Been doing it for like 15, 16 years now. Anyway, so let's go back and the implant is in, but at this point I don't want to put anything. If it's in the back, you know what, nobody can see it, just let it heal. Don't put a flipper on it. If it's in the front, it's a different scenario. So you have options. Basically, you can get like a little Essex retainer, you know, like the ortho one, and they can put a little tooth. Or sometimes you can even get what we call a Maryland bridge. It's like a plastic tooth, and you can get that kind of attached to the side, and it's fixed, but the implant is underneath it. The big thing is when you put an implant, you don't want any pressure that comes on it. That happens if you have a flipper. And I don't like flippers at all on top of implants, because they can activate the implant, and that can lead the bone that's holding like around the neck, it can actually start to shrink away. So I am not a big fan of flippers on top of implants. I am more, let's get something a little bit more fixed, or if you want something removable, then it's an Essex retainer with a little teeth. It's not touching the implants at all, okay? Then what? Now we wait. And this is when we have to be completely patient, because we put the root, now we wait and pray that the bone cells are gonna like it, and they're just gonna go around those little threads of the implant. So the implant is a little root, it's not smooth, it has little threads, and basically we are waiting now for the bone cells to go and basically integrate and fill those little gaps, because then the implant will be attached to the bone, and we call it osseointegration, okay? We pray, we take vitamin D, we take calcium, because we want the bone cells to be happy and basically get the implant in place. And after that, that usually takes between 4 to 6 months. And after that, okay, well, we take another x-ray. If it looks good, the healing looks good, now you're ready to get a crown. The big thing now, we have an implant, we have the crown, life is good, everybody's happy. You have to still do your maintenance, which is every 3 months, you still have to go to get your cleanings and checkups and x-rays. Not every month, you get your x-rays once a year, really. But you have to get that done to prevent gum disease from basically becoming worse, and to keep the implant safe in place. So please, next time you go to see your dentist, don't say, I don't want an x-ray today. I didn't get x-rays for 2 years. I'm scared of the radiation. Guys, if you walk a little bit outside in the sun, that's a little bit of radiation. So please, if you want those implants to stay, make sure you get them checked, you get them cleaned properly, and you're gonna do your homework at home, flossing, brushing. I told you about, double floss, maybe super floss, and basically keep it clean. Warm salt water, you don't need mouthwash. And I am here on YouTube, and I'm here on Spotify and iHeartRadio. If you have any questions, you can always write it in the comments. And of course, like, share, subscribe, and, all the fun stuff. If you need any actual consultation, make sure you put the code 78, and you can get a free consultation, virtual consultation, and I'll be more than happy to help. Okay, my office is in Princeton, New Jersey, Dent Blanche Dental, and I'm Dr. Saad, and I hope you liked the episode. And there is hope, guys, okay? There is hope. Don't let anybody tell you, oh, you're done. No, there is a lot of hope, and I hope this episode brought you a little bit of insight about, the real facts about dentistry, about dental implants, about periodontal disease, and how you can achieve a good smile, okay? Don't forget to take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Bye.